Hello everyone. Today we're going to talk about something incredibly important for anyone who is thinking about becoming sexually active. We are talking about safe sex. This isn't just a clinical topic or a boring lecture. It's about your health. It's about your well-being. It's about your future. It's about empowering yourself with knowledge so you can make choices that are right for you. Thinking about sex can bring up a lot of emotions, excitement, curiosity, maybe even some anxiety. All of those feelings are completely normal. The best way to navigate this part of your life is by being informed. Safe sex is smart sex. Being smart is always sexy. Why does this matter so much? When we talk about protection in the context of sex, what do we actually mean? Protection refers to barrier methods. These are physical barriers that you put in place to prevent the exchange of bodily fluids that can transmit sexually transmitted infections, or STIs. They also serve as a primary method for preventing unintended pregnancy. Think of them as your personal armor for sexual activity. The most common and widely known form of protection is the external condom, sometimes called a male condom, which is worn on a penis. There are also internal condoms, or female condoms, that are placed inside the vagina. Both are incredibly effective when used correctly. But condoms aren't the only tool in our toolkit. Knowing what a condom is only the first step. Knowing how to use one correctly is what truly makes it effective. An external condom, the most common type, needs to be put on an erect penis before any sexual contact occurs. First, always check the expiration date on the wrapper. Also, check the wrapper for any tears or holes by pressing on it gently. If it feels flat and there's no air bubble, throw it away. Open the package carefully with your fingers, not your teeth or scissors, to avoid tearing the condom itself. Once the package is open, determine which way the condom unrolls. It should look like a little hat. Place the condom on the tip of the erect penis. Pinch the very tip of the condom to squeeze out any trapped air. Let's demystify the term STI. STI stands for sexually transmitted infection. Sometimes you might hear the older term STD. We prefer using STI because infection is a more accurate term. Anyone sexually active can get an STI, regardless of gender, regardless of sexual orientation, regardless of number of partners. There are many different types of STIs caused by different germs. Bacterial STIs, chlamydia, gonorrhea, syphilis. Bacterial STIs can usually be cured with antibiotics if caught early. Viral STIs, herpes, HPV, hepatitis B, HIV. Viral STIs generally cannot be cured. Many viral STIs can be managed with medication to control symptoms, reduce transmission risk, allow you to live a long, healthy life. Talking about safe sex with a partner, especially a new one, can feel intimidating. Bringing up safe sex is not a mood killer. It's actually a sign of respect, care, maturity. Consent is not just a buzzword. It is the most important rule of sex. It is the presence of an enthusiastic yes. Silence is not consent. Consent must be clear. Consent must be ongoing. Consent must be reversible. A person cannot give consent if they are incapacitated. This includes being drunk, high, passed out, or asleep. Engaging in sexual activity with someone who cannot consent is sexual assault. Safe sex is not just about protecting your physical body. It is equally about protecting your emotional well-being. Emotional safety means feeling respected, valued, comfortable with your sexual partner. It means you can be vulnerable and express your needs and boundaries without fear of judgment, ridicule, or rejection. Respect is the other key pillar of emotional safety. Respect means honoring your partner as a whole person, not just as a sexual object. Creating an emotionally safe space allows for better sex. When you feel safe and respected, you are more likely to relax, explore, communicate your desires. Your sexual health is a lifelong journey. The information we've discussed today is a starting point, a foundation for you to build upon. As you move through life, your body, your relationships, your needs, stay curious and seek out reliable information. Make it a habit to get regular sexual health checkups at a doctor or clinic. Healthcare providers are there to help you without judgment. They are your greatest allies. If you feel unsafe, pressured, or confused or hurt, please know help is available. You are never alone. Finally, a message of encouragement. Navigating sex and relationships can feel complex. You have the power to do it safely and confidently. Arm yourself with knowledge, practice open communication, insist on consent and respect. Make protection non-negotiable. You deserve to feel empowered, safe, and respected in every aspect of your life, including your sex life.